Good morning, everyone, and thank you so much, Labitza, for the invitation to present today. I, as well, would like to acknowledge that we meet on the land of the Kulin Nation people, and I pay my respects to the elders throughout their history and the elders, the present elders, and the people that are coming through. So, thank you. Yes. The solutions and strategies. We all like to talk about the problems. There are so many issues, but it is important to address these issues with solutions and strategies. So through the work that we've been doing in the diversity framework, I will be talking about some of these today. FECA is funded by the Department of Health, and we greatly appreciate the ongoing support given to us by the department. And we're particularly pleased that Minister, the Honourable Ken Wyatt, is very passionate about diversity. And he has a group of committed people, and my esteemed colleague, Nolene Tunney, who really loved the presentation, and so many things that Nolene and Stephanie and Rhonda covered are directly translatable to people from culturally and linguistically diverse backgrounds. I just wanted to start a little bit about FECA. Not everyone knows about the Federation of Ethnic Communities Councils of Australia. We're going to be celebrating our 40th anniversary next year, which we're quite proud of. So we are the national peak body representing culturally and linguistically diverse people, and FECA's role is to advocate and promote issues on behalf of this constituency to government, business and the broader community. At the heart of our work is promoting multiculturalism. And we want to see that embodied in equitable policies and non-discriminatory practices for all Australians, regardless of their cultural, linguistic, religious, racial, ethnic background. And FECA strives to ensure that the needs and aspirations of these people are reflected and heard by policy and decision makers, as well as the broader public. So it is a big job, as we know. Many people are from culturally and linguistically diverse backgrounds, and the older cohort that are ageing in Australia are becoming very large, and their voices need to be heard. Something that strikes me when we look at data, and there's always a need for more data, disaggregated data, is the Australian Institute of Health and Welfare say that by 2026, as we're living longer, 1 in 4 people aged over 85 will be from a diverse, non-English speaking diverse background. So that's looming, it's coming up very quickly. So we need solutions and strategies to combat that. A little bit of background. We're working on the diversity framework, as you all know. Preceding that were strategies that covered CALD and LGBTI people. There was none for Aboriginal and Torres Strait Islander people. So this, in a way, the new diversity framework is fundamental. It's groundbreaking because we are recognising our First Nations people in the called action plan, in the Aboriginal and Torres Strait Islander action plan, and there are intersectionalities. So it's a very exciting time to be in aged care and to have the support of the department and the minister. So the 2 preceding strategies went from 2012 and they finished in 2017. There has been a review, but they were basically government action plans. The new diversity framework and called action plan will be something that will have potential actions for providers, aged care providers, for government, for peak bodies and representative bodies, and for the consumer. So that's a big change. The diversity framework was launched at Parliament House in December, and that's a photo of most of the group. And Nolene's covered a little bit of that, so I won't stay on that too long. The framework has a human rights-based approach, which have vision, overarching imperatives, outcomes for consumers, and that's basically where the solutions and strategies lie. There's also going to be an evaluation, reporting and monitoring part of the framework, which we're very excited about. The structure of the action plans, they're written in the consumer voice, the I voice, and they include specific actions for Aboriginal and Torres Strait Islander people, CALD and LGBTI. They include general actions that will meet the needs of all people with diverse life experiences and characteristics, and there's suggestions for providers on how to meet these actions. There will also be, it's going to be a very comprehensive document. There are going to be case studies, so providers that perhaps are not used to looking after people from these diverse groups will have, case studies that they can refer to. So we have been gathering case studies from our consultations, inviting people to provide them. There'll also be some resources. So we have developed quite a comprehensive resource list with links to certain different types of resources that will assist providers to meet these potential actions. Now, FECA, to inform the development of the called action plan, developed consultation guides and questions. We held consultations. We acknowledged the assistance of the partners in culturally appropriate care groups from various states and territories. They've been very, very helpful to reach communities. We've talked with individuals, cultural ambassadors about their groups, and peak bodies. We've had some fantastic feedback from Dementia Australia and also Monash Health here in Victoria, which I acknowledge their support and greatly appreciate it. Our online survey attracted over 500 responses. We had a survey for consumers and one for providers. The average length of time that people spent filling out the survey was 22 minutes. So they did devote quite a lot of time, and we're very appreciative of that. We also translated the consumer surveys into 8 languages, and they're listed there. And something that the diversity advisors here in Victoria, who have been fantastic, and I acknowledge, could they please put their hands up? I know there's some here in the audience. There they are. Thank you. They've been fantastic help. And they suggested, because a lot of our cultures can't, people from diverse backgrounds, they don't have access to computers. Their digital literacy is not the same as most mainstream people. What we did was we had a PDF version of the survey on there, and they assisted, and other groups as well, to print these surveys off, give them to the groups. They filled them out, scanned them back, or we actually got massive envelopes filled with the responses. So we've had great response from Italian groups, Vietnamese, and some Spanish people as well, and Serbian people, and that has really helped to reinforce and to give us, I guess the confidence to say, well, this is what our people want. This is what they've said that they're having issues with, and we are aiming to deliver that voice. And what we're going to do is have a look at some of the responses. So the framework, the vital part are the 6 outcomes. So the first one, making informed choices, is about older people having easily accessible information about the system. And we heard previously from our previous speakers that my aged care, for all its intents and purposes, it's a great way to offer a service nationally, but it is not user-friendly. And the same issues that the Aboriginal and Torres Strait Islander group externalise is the same for called. It's just not working. So we do need people to assist them to navigate that, and I'll talk a little bit about that later. The second outcome is about older people being active partners and actually feeding into the development of the system and the further unique areas that need to be finely tuned to make it much more user-friendly. The third outcome is about people who live in rural, remote, metropolitan areas, but even in metropolitan areas. I was speaking with someone from Victoria yesterday. Melbourne's a big suburb. There are people living in the outer suburbs that they could be in a rural or remote area. There's no transport for them to get to services within the city. So it's about having access, no matter where you live. The fourth outcome, responding to the emerging trends. We hear this new and emerging communities. What is that? Where are these people? We do have people working out there and case studies to say that some of our members and affiliates are seeking out new and emerging groups and assisting them pro bono to access the system and to have services delivered. So that's outcome 4. Respectful and inclusive services is quite self-explanatory. Services need to effectively meet the specific needs of people from culturally and linguistically diverse backgrounds. And the meeting the needs of the most vulnerable, that's about older people being able to access high quality and culturally safe. We've heard about cultural safety before, aged care services and supports that meet their needs irrespective of their personal, social, economic vulnerabilities. And I think that is increasing in Australia. So some of the solutions that have been articulated from our consultation series for government, the big one, the Aged Care Navigator. And I'm really thrilled, I was really thrilled, and many people were, about the budget announcement, the $7.4 million that is going to be attributed to piloting aged care navigators. Fantastic. It has to be delivered by people who understand culturally and linguistically diverse older people and their vulnerabilities. They will not go to a mainstream service navigator. That is a barrier. These navigators that the government is proposing, that has committed to deliver, must be delivered by people who understand biculturalism, bilingualism, and the specific needs of older called Australians. Otherwise, it will not be a successful budget measure. We have had feedback that the residential and home care agreements are problematic. They need to be written in plain English. Now, aged care service providers have said to me it's a legal document. We can't do anything about it. But there are things that we can do. We need to deliver them in a plain English format. We need to work out ways that they can be translated, or certain sections can be translated. So there's a lot of work to be done in that area. And again, linked to that navigator service, support-funded options for community organisations, information hubs, by people who understand different cultures and who are friendly, who can actually be approached. And it's not just, and people that have aged care specific expertise as well. So moving on with that outcome 1 for aged care service providers, these are some of the strategies and solutions. We want information about aged care support, care and supports. Again, plain English kept coming up. We want plain English. An example that was presented, and I do think that the department are working around this was the letter that was sent to people advising them that they had been assigned a home care package. And the language, when we looked at that letter and we looked at the language, assigned, approved, comprehensive, all these words that are problematic and not easily understood, even by people whose first language is English. So we need clearer communications from the government, but also aged care providers need to do that as well. Translated brochures. Make sure that you display your Charter of Residents' Rights and Responsibilities, and also display the translated brochures from the Aged Care Complaints Commissioner. One thing that came up in one of our consultations was with a large group of Turkish people, they had no idea about how to make a complaint about aged care. So we worked through that with them. So our consultations were not just about gathering feedback, it was also about educating too. So it was a bit of a very satisfying experience because we felt that we could give something back to some of our communities. There are problems around knowledge about the translating and interpreting service. Some providers aren't even aware of it, and the access to that service seems to be a little bit blocked for many reasons. And the other thing was that the compliance status or the accreditation of that organisation, people want to know where to find that. And I think with the new standards and the reforms happening there, that's going to be addressed by the Quality Agency. So we really welcome that, and we need much more information around that. So the second outcome, again, like the previous speakers, the NSAF, the National Screening and Assessment Form, is very intrusive. Some people, we had feedback that commenced that assessment process and then they just said, stop it, it's too hard. So that is a barrier in itself. So that needs work. And I know there has been a review of the NSAF. People want interpreters there during accreditation and quality review. The feedback was that reviewing 10% of an organisation's residents during review processes was not enough. And, out of that 10%, how many called people are actually being interviewed about their experience in the home? There really needs to be some growth funding for new and emerging groups. We found from our consultations around the country that people don't have the opportunity to provide social support services, social support groups through the Commonwealth Home Support Program for new migrant groups. In Western Australia, we came across a very dedicated bunch who were just doing it all for nothing, and they were attending to the needs of older Africans there, Southeast Asians, with no funding. So the government needs to understand that there are new groups that need support, and they need to be supported like the previous migrant cohorts and to be given the same opportunities. Constantly we were hearing about the GP. The GP is quite central to the lives of many of our older called people, and they want to receive information from their GP, especially if their GP speaks their language. They have developed the trust and rapport. That kept coming through all the time in the consultations. Trust and rapport from the GP. But FECA does talk with various bodies, including the AMA, which I was quite privileged to have a conversation with a couple of weeks ago. GPs just simply don't have the time. So that's something that we need to work on. again, I'll skip that one because I've talked about the navigators. The other thing that came through in the regional areas was that the assessors were not quite up to speed with cultural competency, and that was a barrier itself. I've been given the 5. Okay, thank you. Okay, so outcome 3, I think that some of the ideas that came through was to use technology to mitigate social isolation and loneliness. That's something that's really important, and we've got some things. Can this presentation be made available a bit? Yeah, so if I don't get through it all, you can have a copy, and I'm always happy to talk to people as well, because I really do want to spend the last couple of minutes on a couple of the strategies that we've come across during our consultations. So this is a case study which can really align with several of the outcomes: accessible care and support, proactive and flexible system, information. So the Association for Culturally Appropriate Care is something that is a Western Australian initiative, and I'm really happy to see some people here from Western Australia today, which is fantastic. So it's a hub and spoke model. It is set up due to the mounting pressure on aged care services to respond to the needs of the core population. And I think some of you might relate to this. Many are struggling to remain financially viable, particularly those in rural and remote areas, and providers who are looking after the most disadvantaged. So this is a collaborative approach to sharing the strengths of called aged care providers to support each other to provide quality care to their targeted called clients. Collaboration aims to provide a hub and spoke model where AFCAS will be the hub from which members and member organisations can choose to receive at cost prices the services such as what's written there: payroll, marketing, all that stuff, quality assurance, human resources, are things that do cost a lot of money. So it's cost price for members, a commercial price to other service providers, and it seeks to support the embedding of diversity in the design and delivery of aged care. I thought that was a brilliant case study to bring to the table today, and it will be, I have the permission of the people to produce that as a case study for the called action plan. Another one here, I didn't have the correct picture. So we have, I couldn't get it, so I've just gotten something off the internet. It might be from St. Louis, Missouri. I'm not sure. But I wanted to paint the picture about this fantastic strategy and solution. It's a mobile aged care information and support van. And I'm pleased to say that the person responsible for this is here today, and actually the esteemed winner of an award last night. And she kindly shared this with me. The mobile information van is packed with helpful resources for vulnerable senior groups and families. So some of the information: what is the Australian aged care system? What is the eligibility criteria on different aged care programs? How do I access services? Information on the My Aged Care website. How to stay independent at home. How does CDC work? Who can be involved in managing your care, retirement and residential care services? So it's, it's a mobile van, and it doesn't look like that. It has got different writing on it. So they also have information in Polish, Hungarian, Spanish, Italian, Macedonian, Croatian, Serbian, Hindi, and I also understand other languages as well. So a fantastic solution, and something that I hope that other providers might take up. Moving right along, we've had great feedback to strengthen the PIC Act presence in all areas of Australia by providing adequate resourcing to collect data on called access barriers and need for daily assistance for called older people. I think that needs a round of applause. So the other area was, I just want my gutters cleaned, I just want my lawns mown, Do I have to go through an assessment? Do I have to go through that? So some of the ideas about simplifying one-off procedures by a voucher system, etc., that will be in the action plan as well. And many things there, respectful, inclusive services. Let's increase the bilingual ACAT and RAS assessors. That came through very, very clearly to us. Enable free access to face-to-face or telephone interpreting services. Let's make that, that service simplified for our older people. They cannot hang on the phone for an hour or 2 hours. They are frail, they are vulnerable, they need a little bit more of a targeted and easier system to work with. So there's lots of information there, and I wanted to just probably concentrate on that last one. What came through in our consultation, what is the definition of vulnerability? We need a definition of that. And from our feedback from some of our stakeholders, it includes things like elder abuse, domestic violence, homelessness, which the homelessness action plan is coming after these first three, social inequality, mental health, PTSD. A lot of our older migrants are suffering with PTSD from their history, from the wars they've been involved, from their migration experiences. Social isolation due to a lack of English language proficiency. We also have vulnerability around people wondering about their visa status, the insecurity about that, lack of family connection, physical and intellectual disabilities. We have older called people who are looking after their disabled children. What is going to happen to them? They are stressed about that. Poor health as a result of environment, which includes overcrowding and a lack of access to utilities. I think we have case studies. We've been able to, and we really gratefully appreciate all the contributions to the case studies. They will be in the action plan, as well as the resources for providers. So FECA has been working to find a lot of these resources. There are a lot on the Centre for Cultural Diversity in Ageing's website, and we'll hear about their new inclusive service standards. So there's a wealth of information coming your way. Please keep a lookout for it. And we do have copies of the diversity framework here at the PICAC table. So please help yourself to a copy of the framework. And then the action, thank you, there it is there. And the action plans are coming very, very shortly. So thank you for your attention, and I wish you well for the rest of the conference. Thank you.